Welcome to the Medical Device Made Easy podcast. Here is Munir Al-Azouzi from easymedicaldevice.com. And today we'll talk about IVDR. So we had talked last time about the transition period that has a bit changed, if I can say, for some products in IVDR. Today, we have a new topic, which is the common specifications. So we had a publication of the Draft Common Specifications for certain Class D devices under IVDR. And I have with me Andreas Stange, Vice President at TÜV SÜD, who will try to help us understand what is this common specification and how this is working mainly. So Andreas, welcome to the Medical Device Made Easy podcast.
Yes, hello, Munir. Thank you for having me today. It's
Great.
A pleasure to discuss with you this topic.
Thank you. So, Andreas, as we said, so we will talk mainly about this topic of common specification. But before that, maybe a small introduction of yourself so that maybe people will know more about you.
Yes. So I'm with TÜV SÜD, and TÜV SÜD is a notified body under both IVDD and also the IVDR. We are quite active in this field. We have issued the first IVDR certificate in 2020. And we are, of course, engaged a lot with clients in bringing their products to certification under the new regulation. Myself, I'm responsible for the IVD business segment at TÜV SÜD. I'm based in Japan. I have to say I'm not an IVD expert, but of course we have a broad team, and I have a long time experience with medical device certification and so on. So that's for quite a long time my daily business.
Yeah, great. So the point is, I know you a lot since a long time now with the IVD business in TÜV SÜD. I participated in some of the trainings that you have done also on IVD, so I know that you are really knowledgeable enough to answer all the questions that we are talking about today. But before that, as we said, we had this transition between IVDD and IVDR. So what is the current situation for the industry? We had, as we said, this transition period that changed. We have more and more MDCG guidelines that are issued, a lot of things that are coming. So what is your update on that as a notified body also?
Yes. So yes, there has been quite a lot of movement in the recent months and weeks. We have suffered, so to say, from a fairly slow implementation of the necessary infrastructure concerning the IVDR. There was a long time demand or rumors for a change of the date of application because notified body capacity and industry preparedness was not, the whole implementation was not going fast enough. And then finally we saw in the last quarter last year, we saw a change to some important articles of the regulation. These change came into force in the beginning of this year, and they have quite a big effect on the transition period. The date of application remains unchanged, but the transition period is affected quite and gives manufacturers who have placed IVDs on the European market already more breathing room, and that changes the dynamics quite a bit. So for one, we are while we have been previously basically busy with all applications coming in, now manufacturers, because of the shorter timeline for high-risk devices, are focusing on the submission of high-risk devices. They have the shortest transition period. Plus, we see that IVDD certificates can have a longer validity time. So previously, the maximum validity was May 2024. Now that is extended by 1 additional year, and we are quite engaged to help our clients to prolong or to maximize the period of their IVDD certificate. So that keeps us very busy. Overall, we see some slowdown of applications coming in. Nevertheless, we are, of course, very, very busy, and our biggest concern is that we wait for more notified body capacity becoming available. So far, we are only 6.
Yeah.
We need more colleagues from other companies to be available to support the certification activities.
One thing maybe from what you've said, the date of application is the 26th of May 2022.
Yes.
But if you place for the first time your product the 27th of May 2022, you have to apply IVDR. It's not like there is a decision here, because I may just to clarify for some people that think, we have until 2025 or 2024, 2023. No, if it's only if you place devices before the date of application. After that, you are on this transition period and you have to execute as it's the first time you place it on the market. So
exactly, that is correct. So the key date is the date of application. If you place devices by then on the European market, regardless whether they have an IVDD certificate or whether they are just self-declared, that does not matter anymore. Then you have the additional transition time depending on the future classification under IVDR. Yeah, so for Class D devices, it will be then another 3 years till 25. B then 4 years, C then 4 years, and B then 5 years. So that is, so to say, a staggered approach. This is correct.
Okay, great. So I think, so don't wait. Mainly the point is, don't wait, make a plan now and try to have a notified body already, discussion with notified body, and then start your process. And not because there was an additional transition period for some products that you should maybe think, oh, let's wait. But no, you have maybe to take the chance, because it's a chance to apply as soon as possible, because maybe just to find a notified body, as you said, there are only 6. Just to find a notified body can already take some time there.
Yes, that's right.
Great. So let's talk now about the common specification. So we had the common specification, draft common specification that was published for IVDR. So before maybe to dig inside this common specification, why do you, can we explain why do we need a common specification? So what is the reason for publication of a common specification? In which case do we need a common specification?
Yeah, so the concept of common specification is not a new one. So we have basically a similar concept or the same concept already under the IVDD. Under the IVDD, these are called common technical specifications. So, and in Article 9 of the IVDR, it is described that in the case when harmonized standards are not good enough or are not stringent enough for compliance, then the Commission may adopt common specifications, which are basically mandatory to meet by manufacturers. So why is that so? The common specifications are developed for high-risk devices. So where there is, let's say, where we really want manufacturers to be in the published specification, where it's very crucial for a safe and efficient medical device to meet these specifications. So that is why these common specifications are then developed. And as we see also later, when we talk maybe about the different devices, these are all high-risk devices, so very dangerous and deadly diseases, which are then detected with these devices.
So in terms of common specification, so we talk about that under IVDR. But what about IVDD? Was there common specifications also for IVDD for some of those products?
Yes, they for the Annex 2 products, there were common technical specifications. So these are specifications which basically must be met by the manufacturer in order to put the device to get the certification of the device. And also now under the IVDR, the regulation very clearly says that manufacturers shall comply with these common specifications. So there's basically no excuse not to do that. So in case they don't want to do it, they must have very, very good reasons and must explain that in very detail. And basically, it is it will be very difficult.
Yeah. No, I think it's to be clear to say that it's not like voluntary things that you have to apply. It's really specifications and like standards that you have to apply. That, I mean, it's even, can we say that it's even more than standards, because standards can be voluntary, some of them, and here it's mandatory.
Definitely. Yeah, it's more than a standard. It is more than a harmonized standard. And that is also explained in Article 9. The harmonized standard is a standard where when the manufacturer applies the harmonized standard, the notified body will assume conformity with the regulation. So this is an assumption, but it's not mandatory. So the manufacturer may also use other standards, and then they have maybe the scrutinization and the assessment is more detailed and more in depth. So it's not automatic assumption of conformity. But since that is, so to say, up to the manufacturer to apply harmonized standards or not, with the common specifications, so to say, it is more strict, and there is basically very little possibility not to apply the common specifications. That is the difference.
So here we said also that it's common specification for certain Class D devices, so not also. Does it mean that it exists already for some Class D devices, some kind of standards or some harmonized standards are existing, but for those ones specifically, there is nothing? So is it what it means, or?
Yeah, well, I mean, there are, of course, numerous Class D devices, and the development of such common specification takes time. And so that is why we have not to begin with for every device's common specifications. For those devices where there are no common specifications, then there's no state-of-the-art possibly established. Then the notified body need to consult with the expert panels, and there we receive then the opinion of the expert panels, and this then basically establish a sort of state-of-the-art or benchmark. And this benchmark will then need to be met by the next devices which are certified. So that is then the mechanism for these Class D devices where there are no common specifications available.
So now for this one that was published, first, was it, does the manufacturer, were the manufacturer waiting for it, or it was something that really they are expecting, or it's coming like that out of the blue and nobody really knew that something like that would be common?
Oh, yeah, that's a good question. No, it was not coming out of the blue. We are waiting for that. And I think when we look at the rolling plan, the common specification publication was expected quite some time earlier already. Why is this so important? Because without them, as I explained, you have to go through the expert panels. The expert panels were also just established in September last year. So before that, there was basically no way to certify a Class D device under the IVDR. That's one thing. The second thing is, with the common specifications, it's very clear what performance criteria need to be met. I mean, there is no discussion anymore between notified body and the manufacturer. Is this now good enough, or is this not good enough, or do you need to have more patients involved in the clinical study or not? So this saves a lot of time and eliminates all uncertainty in terms of the required specification, so that everybody was waiting for that. As you said, some of these devices or some found there are already basically similar or identical to the common technical specifications under the IVDD. So that's nothing new. They are basically taken over as far as I see. So for those, that is no surprise for nobody. Né? But we have, of course, a couple of new devices, SARS-CoV tests, for example, which we urgently need in order to make a smooth certification of these products.
Great. So as you started to mention some products, so what do you have? Is there a clear list now of products that are under this common specification, or as we say, it's a draft? So, or will there be more, or it's like this is the list and here is what we will be talking about?
Yeah, well, what we have mentioned in the annex of these common specifications, these are the devices which will be found in the first batch, so to say, of common specifications. But we will expect in the second part of the year, maybe in Q4, we will expect a second batch of other devices, of common specifications for other devices to be following. Yeah.
Okay. So just to come back to the sentence, to what you have said before, for the second half or second batch, can we certify them without those common specification?
Yes, we can. But we need to then go through the expert panels.
Okay.
Yeah. Okay. So the way through the expert panel is now open, and we can regardless of whether we have common specifications or not, Class D devices can be certified. But the way is a little bit more longer. Yeah.
Okay, is it? I have another question, because I am looking at what the expert panel is delivering, and I see a lot of expert panel for Class D devices for IVDR, more than MDR, so more than medical devices. So is this the reason? Is this the reason why we have so many expert panel reviews, because those common specifications were not available, or it has another reason?
I have to admit, I don't know exactly which devices were now in detail reviewed by the expert panel, but I believe that is one reason. Okay. Yes, that we did not have yet the common specifications available. Okay,
so I think it's why this is really important. So, with what do you know? Do you have some type of disease or products that we are talking about specifically inside those common specifications?
Yeah, we have some blood grouping agents. We have HIV tests. We have hepatitis tests, and we have newly added the COVID test. Yeah. So you see, for instance, I believe one of the expert panel reviews was also covering a COVID test. So that would now not be necessary anymore to go through that. But you can find once these common specifications are published, you can apply them.
Okay, so inside this common specification, as we say, it's in draft actually. I have looked at the web page, and it says that you can. It's still under consultation, so people can still comment on that until March 9th, and it will be tomorrow when this podcast will be published. So the thing is that I was really surprised, because I was also working on the previous common specification for MDR, Annex 16, and there around 1,000 comments provided for this kind of things. And when I looked at this one, I tried to read and see what kind of comments there is. There were only 7 comments or 7 feedbacks coming, feedbacks about maybe to have, some people ask to have more stringent performance evaluation or to change some measuring unit or this kind of thing, but it was not too much. So you, as a notified body, if I can say, were you able to review those comments and maybe provide your comments on that?
So we have been notified bodies have been engaged or involved in the drafting of these common specifications already at an earlier stage. So we had discussions with the Commission, and we also were participants of a workshop. Notified bodies are organized in the team NB, and as such, we have already seen them. And we have provided our input at an earlier stage already. So our current, let's say, input would be, publish them as soon as possible.
Okay. So does it mean also when we receive those feedback, if I can say, will you also be consulted as a notified body from those feedback to say, yes, it's correct, we should change this or that? So you are not in the loop anymore?
I don't think that we are now in the loop anymore. Okay. I think this is now in the hands of the Commission, but we have been providing intensive input in earlier stages.
Okay, so when do you think this will be? Because as we say, it's a draft. So when do you think this then will be really coming as a common specification published and available for all the manufacturers?
Yeah, I believe latest in Q2 of this year. So in the coming months.
Okay.
I'm not sure, maybe 2 months or something.
Do you think that from now, manufacturers can already look at this draft and check and already say, okay, let's apply these rules and that rules? Because inside the draft, it says, as you said, exactly which parameters they have to take and to look at for each of the sensitivity, specificity, or whatever that is on the product. So can they look at it now, or do we expect maybe some changes of those parameters?
Yeah, I don't expect any major changes. No, no, it would be a smart idea to look at it now. Yes, because once they are published, there's a transition time of 2 years. And after these 2 years, they are basically mandatory. But even before, if a manufacturer wants to certify a device before this 2 years transition period is over, still they would, of course, we would have to look very carefully in case they don't meet these specifications. Because these specifications have, of course, some valid reason. And we would then need to really see, okay, why are we not meeting them, and what is the differences? Is this a matter of maybe just a smaller number of patients in the clinical trials, or do we have big deviations in the specifications, in the measuring range or in the specificity or something, right? That needs to be then looked at in detail and thoroughly. Needs a thorough discussion between a notified body and the manufacturer.
Okay, and when you said 2 years transition period, means that as soon as it's published, you can still voluntarily use that, but it's not mandatory then?
That is, so to say, the situation. They are not mandatory applicable. But the notified body will, of course, seriously question the device if it's not coming close to these values.
Okay, and if notified body sees that we are not following those common specifications, they have to go through the expert panel, I suppose, also.
I don't know. No, the expert panel is not necessary anymore. No? Okay. This is just a discussion between notified body and the manufacturer, and that needs to be sorted out. Huh?
Okay, then it's good then. So I encourage people, if you have still time to read that today, immediately after listening to this podcast, maybe to go then and to have some feedback to this draft common specification, because you have until tomorrow to get that. Anything else you want maybe to talk about this one, or the common specification, or maybe in vitro diagnostic advice for our manufacturers that are listening today?
Well, I really like to encourage manufacturers not to slow down with the efforts to certify the devices. We see a little bit of slowing down of applications, so I would like you to reach out to notified bodies. We have a IVDR service request page where manufacturers can specify their devices and express interest in certification. So that is my hope that we can that we are not slowing down here, and because time is still tight. Even though these transition times are a little bit more generous, but in fact, still the work is tremendous.
I mean, we have this phenomenon, if I can say, within IMDR, where we said, okay, we are recertifying everybody before the 26th of May 2021, and now all the certificates will expire by 2024. So now there is a peak I can say, of workload for notified bodies by 2024. So I understand the thing to say, can we please make something more balanced instead of having everything at the end and then nothing in the middle?
Yeah,
but yeah, I think it's the situation here.
Yeah, exactly. It's very similar with the difference that we at the same time have to ramp up our teams. Now, I mean, we are continuing ramping up experts, not only Germany, also elsewhere. Yeah, and trying to be as receptive as possible to incoming requests.
So if you want to be an auditor for TÜV, so don't hesitate to go to their page and apply for it. I think all notified bodies look for talents. So I think
yes, and we have very nice very nice places to work. I'm based in Japan. We have teams in Korea and China and the United States. Very beautiful places: San Diego, Boston, and of course Germany, UK, Italy, you name it. Yeah, so very welcome, and I think we have a great team, and good working atmosphere and interesting job.
Great. Yeah, I know. I mean, I'm talking to more now with notified bodies, and when you see that, it's really great. I mean, I think for me, for somebody that wants really to be a specialist in regulatory affairs and quality, working for a notified body can be really an advantage, or having something more on your CV, which would be great. So don't hesitate for doing it. I have not done that. I didn't have the chance to do that, but it would have been my pleasure if I can say to work for a notified body for a few years then. But I think it's great. Okay, Andreas. So thank you. It was really a pleasure to have you. Yeah. And I hope this helps a lot of the IVDR manufacturers that are trying to place their devices on the market. Don't forget, we have to apply as soon as possible and not waiting. And those common specifications will become mandatory. So you have really to look at them and understand and provide your feedback maybe by tomorrow. So Andreas, it was really a pleasure. Thank you. And I wish you a nice day.
Yeah, you're welcome. Thank you very much. And good day to Europe. Yeah.
Thank you.
Bye-bye.